Well, it'll be happening soon, maybe where you work, maybe through the government. Either way, you're going to have to make some decisions about health care soon. Licensed insurance agent Kelly Parton of Health Markets Insurance is happy to help with that process. Good morning, Kelly. Good to see you again.
Good morning, Amanda. Good to see you.
You know, our seniors really need to be ready because their window here is opening up pretty soon.
Yeah, that starts this Friday. They can start enrolling in new plans that they like starting Friday, the 15th. And they have until December 7th, and these plans will be effective January 1st of next year.
And this is Medicare, and Medicare can be kind of complicated. I mean, there's a lot of parts, or you could just do your Medicare Advantage and lump it all in.
It's kind of, that's an understatement. Going from 5 to Medicare, the government gets involved. There's a lot of things to think about. There are better options when you turn 65, but there's some things you have to be aware of. And the plans out there, they don't cover everything, so we want to make sure that we, sit down and talk about that.
Yeah, so people can come into you. They can bring, a list of their doctors, their medications, all of those things that are really important to them on a regular basis, and you could sit down with them and find the right plan.
Exactly. It's, one medication on a list of 4 or 5 can make a big difference. What your friend has may not be good for you, and what you have may not be good for them. So it's good to sit down and make a good analysis about it. We look up the doctors, make sure they're in network, and that's very important because that can change every year.
Absolutely. And, and doctors are really important, really to everybody, but seniors too, because many of them may have been seeing the same doctor for decades.
Exactly. And sometimes those doctors do change networks from one year to the next. And not every time does a senior find out about that. So they go to their doctor and they find out, oh, they don't take my plan now. Or, what do I do with this? Because I've had this doctor for 30 years. So want to make sure that we get everything covered and find out what's important and take care of it.
So folks can just give you a call, you set up an appointment, and you guys meet with them, and it's free to them.
Of course, always. Even if we don't find anything to change. We're not looking to change anybody. I love to have people that they're in a good place. Even if there's a plan that we can't enroll you in, whether it be like an OPERS or an STRS, we do this service for free. We enjoy helping people out. So just give us a call with the number down there and let's make an appointment.
So is there anything that folks can do to make their plan better? I feel like all the time we're like, well, it's only going to get worse and worse every year. It's going to get more expensive. It's going to get, less coverage. Is there anything that people can do to make that plan better?
There are some supplemental products that people can add on. Cancer plans are very good. I think every American should have one because when that happens, what happens to you, what happens to your lifestyle, your family. I mean, the meds that you run across can be very expensive. So there's some things that you can do to safeguard and kind of buffer the costs. So we're willing to talk about everything.
When you were on last time, in case folks missed it, you had mentioned that there might be some better coverage with the Medicare Advantage plans in this area this year.
Yes, one of the carriers, I can't name specifically, did open up. I think they're one of 2 that has both Mercy and ProMedica in network. So if you need to have both, just give us a call and we can sit down and look at it. And if it's the right one for you, let's do it.
And then we want to give people just a heads up, folks who are going to be enrolling in what we call Obamacare, government health care if you're under 65. That's going to be coming up soon for people. They need to be thinking about that.
Yes, that open enrollment period starts November 1st, and it actually runs until January 15th, where last year, December 15th. So that season starts here soon, and we do the same thing. Again, look at where you're at, how to insure you, find out what's important to you, because again, what's important to your neighbor may not be important to you. So it's very, diligent to sit down with us. Let's look at all the options. Yeah,
so for Obamacare open enrollment November 1st, but in the meantime, Medicare open enrollment starts Friday. So Kelly, they can give you a call and set an appointment now.
Of course, they already are, and I appreciate everybody calling in. We're going to be busy this fall, so give us a call. Let's schedule something, and let's get you taken care of as soon as possible.
Wonderful. Kelly, thank you so much for joining us this morning.
Thanks, man.
Yep, take care. When your day returns.